everybody. So for this session, I really just wanted to introduce myself, tell you guys kind of who I am and a little bit about what I do. And so I thought the easiest way to do that was going to be to answer some of the most common questions that I get from people, and along the way, so you don't have to just stare at my face for 30 minutes, show you some pictures of some of my patients while they're getting treatments. So the most common question I usually get first is, well, who are you and what do you do? For me, when someone says, who are you? Like, my immediate response is, oh, well, you know, I'm an aunt. I have 10 nieces and nephews, and, you know, I'm not just my job. But so when you come see me, you will hear a lot about my 10 nieces and nephews. I have 4 sisters, so it's not all the same family. But between my 10 nieces and nephews, they range in age from about 2 up to 17. So between all 10 of them, I guarantee at least one of them has done the same thing, if not something very similar to what you're going through with your kiddo or infant. So I like to bring up examples of, oh, well, my niece did such and such. And as they're getting older, I'm sure they're probably getting embarrassed by it, but I'm still going to keep telling stories. I'm very close with 3 of my nephews. I actually have a twin sister, and my 3 nephews you'll hear about a lot because I borrow them and act like they're mine and take them places, and yeah. The other thing you'll hear me talk about a lot is my dog. Of course, his picture is in the middle on this slide. It looks a little blurry when the slide blew up, but he is definitely very fuzzy and very adorable. And although I'm not the person that throws him a birthday party and dresses him up, I am the person that acts like he is my child and talks about him nonstop. So you will have to suffer through hearing about my nieces and nephews and my dog. But what you really want to know are, what are my professional qualifications? Why should you come see me? I am a doctor of osteopathic medicine. So for those of you who don't know the difference between a DO and an MD, DOs are medical physicians the same way an MD is. We have all of the same training. We go through the same residency programs. We learn the same things in school. But we also learn about osteopathic manipulative medicine, and we look at everything through the filter of the osteopathic philosophy. And the osteopathic philosophy is very much a holistic philosophy that believes the mind, body, and spirit are all a part of our treatment and all a part of our health. We believe that the body has the ability to heal itself, and it is our job to support that healing. And we can support that healing through traditional medical options, such as, medications or surgery when they're necessary, but we also can support that healing through the osteopathic manipulations that we learn. So my background is that I am actually a general pediatrician. I, after medical school, completed my pediatric residency training up in Hershey, Pennsylvania, at Penn State Hershey Children's Hospital. When I moved down to Virginia, I did general pediatrics. I did inpatient in the hospital in Blacksburg. I did outpatient. I did attendance at deliveries and C-sections. I did it all, including osteopathic manipulation. And it was probably 7 or 8 years that I was doing general pediatrics in the area before I realized that the volume of people that were coming to me for osteopathic manual treatments far outweighed the time that I had to do them. So I ended up having to make a choice, and I am truly passionate about using osteopathic treatment to help support especially babies. And when you see some of the amazing results, it's really hard to say, oh no, that's what I'm going to limit, especially when I knew that we didn't have anyone else in the area doing what I do. when I switched to doing all osteopathic manipulative treatment for my practice, we also didn't have as many options for pediatric chiropractors as we do in the area. We have some wonderful pediatric chiropractors who do a fantastic job, but what I do, everyone is like, well, how is what you do different, or is it the same? And what I do is a little bit different because my perspective is a little bit different. I look at the whole body and I look at the disease processes. So I still think about things from the perspective of a general pediatrician, but a general pediatrician that's very inclusive of alternative treatments and alternative philosophies, and from the perspective of how can we do things to the body to support the body's immune system and support the body healing itself. So I will use osteopathic techniques that, you know, sometimes we'll be talking about bones that are out of alignment, like you might think of a traditional chiropractor doing. Sometimes we'll be talking about soft tissue, connective tissues, ligaments, tendons, muscles, fascia, things that are tight or restricted. So some people will say, oh, well, that's kind of like what a massage therapist might do. And there's a lot of overlap between physical therapy and massage therapy, chiropractic medicine, a lot of the body work, craniosacral, a lot of body work. There is some overlap, but there's also a lot of techniques and things in between that I do that those other areas might not do. So for me, I feel like being an osteopathic physician is a good fit because I get to kind of take all of those professions and roll it all into one. So I have, for me, the whole picture and the whole package. I am board certified general pediatrician. I am also board certified in osteopathic manipulative medicine, which is not very common. And I'm not saying that to, like, you know, make myself sound fantastic or anything, but there are only about 12 of us in the country with those qualifications. So it is kind of a unique niche. I am a fellow in the American Academy of Pediatrics. I'm also a fellow in the American College of Osteopathic Pediatricians. And because there are so few people with my qualifications, I'm currently the president of the American Academy of Osteopathic Pediatricians, so, or pediatric osteopathy. So kind of the club for people who, well, not really club, but professional organization for people who do what I do. With that, I also teach at VCOM, the Virginia College of Osteopathic Medicine in Blacksburg. So that affects my practice because it means that I will almost always have a learner with me. So I want people to know that up front, that you will see a medical student with me, or you might see one of our fellows. So we have physicians who have finished their initial training, whether it's family medicine or pediatrics or some other area of medicine, and they are doing additional training with us in osteopathic manipulation to improve their skills. So you might see one of them with me as well. I am very rarely by myself, but I also don't let them treat the kids unless I know that they will do a good job, and I always check after them because I am also very overprotective of my patients. I'm, you know, kind of classic pediatrician. We all get very possessive and overprotective of what I call my babies. I have a tendency to fall in love with every baby that comes through the door. So I really do approach each patient with, well, if this was one of my 10 nieces or nephews, how would I treat them? And how would I want them to be treated? So if I have a student that I wouldn't let touch one of my nieces or nephews, I'm not going to let them touch any of my patients either. So it's not, although patients do help with their learning process, you're not left alone with a learner having done the final treatment. Being a associate professor also affects my practice in that I am not in the office every day, because there are days that I have academic responsibilities and teaching responsibilities where I won't be in the office. So that does sometimes limit the availability of appointment time. Like, you know, sometimes it's not a super convenient time for you guys, which I do feel badly about. And I make every effort, if I do have extra time, to try to accommodate other people's schedules. All right, let's flip to the next slide, because that's certainly more than enough about me. What ages do I see? So I am actually trained to treat, and I teach other people how to treat with osteopathic manipulative techniques on all ages. The youngest patient that I have treated was 1 minute old, and I did that treatment actually in the OR right after the C-section. The baby was doing great, but really had a significantly abnormal head shape. And while I was standing there waiting to give the 5-minute APGAR score, I was like, okay, well, I'm just gonna treat this baby's head, because, you know, it'll help it round out quicker and it'll help him feed better. And I have 4 minutes with nothing to do. The oldest patient I've treated was 101. So I can treat all ages, but again, because of my limited availability with appointments, my true passion and focus is the babies. So right now I am not taking new patients under the age of, or excuse me, over the age of 12. It's only under the age of 12 that I'm seeing. But I'm spoiled. There are several other doctors in our practice that will treat the older kids and teenagers and treat adults. So a lot of my patients end up, their moms watch a treatment and get jealous and go, I want to be treated. And so we get them on the schedule with one of my colleagues. What conditions do I treat? There's a lot of different things that you can treat with osteopathic manipulation. The one caveat that I will tell every parent is that I don't make any promises, and I don't think anyone can. I treat the areas that I find that are restricted, the areas of what we call dysfunction in the body, but then the body has to heal itself. So our focus is on taking away any of the restriction in blood flow or lymphatic flow or restriction around a nerve that may be affecting the body's ability to function. So as we remove those restrictions, then we have to say, oh, are they getting better? Are the symptoms going away? So one of the classic examples, I treat babies with reflux, and sometimes there can be especially some nerves and some structures through like their diaphragm and their stomach that are restricted and tight that aggravate reflux or cause reflux. So when I treat a baby with reflux, about 10 to 15% of the babies, their reflux is completely gone. And I'm talking like, I've had babies who had horrible reflux with projectile vomiting and were on medications, and we treated them, and within a month they were off their medications and not spitting up except maybe once or twice a week, just normal little mouthfuls of, hey, I overate, baby spit up. Just what you would expect from a baby. That's the effect I wish I could have on every single patient every single time, but sometimes their reflux is not caused by the musculoskeletal system. Sometimes there's a component of a food allergy or something like that as well that's affecting the reflux. Reflux is something that's usually multiple factors affecting it. So I don't always get that perfect result. I would say most of the patients get a significant improvement, but not a true cure. And I will occasionally have a patient where we don't make a difference, and I'll be the first person to admit that hey, this is not the cause of your problem. Like maybe you do need to talk to your primary care doctor about doing some reflux medicine, or doing an elimination diet because perhaps there's a food allergy that's causing this. So I've mentioned reflux. You can see in this picture on the left, the very far left, the picture dated 12/11/19. This is a baby with some plagiocephaly, so a little flattening on the posterior right aspect of his head. And then in the picture dated 12/15/19, this is some pictures after he had been treated, and that flat spot had improved significantly. So I do treat a lot of babies for plagiocephaly and torticollis. I treat feeding dysfunction. So I treat a lot of babies with breastfeeding issues, latching problems, tongue ties, things like that. I treat colic, fussiness, constipation, sleeping issues. Again, sleeping issues is another one where if they have some dysfunction that is causing discomfort that is keeping them up, then we can treat that. But there is no guarantee. I treat a lot of headaches, migraines, TMJ issues. I treating kids before, after, and during, getting orthodontic work and braces, concussions and post-concussion syndrome symptoms, musculoskeletal pain in general. So I'll have patients that'll come in because, maybe they had a fall and, they were walking well, they had their fall, and now they're kind of limping or walking a little bit differently than before the fall, or crawling differently than before the fall. And they've been to the PCP and their primary care said, oh, everything's normal, they're fine. But the parents get that sense of that it's not quite the same. They're not doing exactly what they did before. So those are usually satisfying for me personally, because I'm like, oh, if I find something that is out of alignment or something that is dysfunctional and we treat it, then instantly for most of those kids, they're back to walking or crawling the way that they were before. And kind of going along with that, I will have kids that I treat sometimes with developmental delays in motor skills. Now, obviously, again, developmental delays are multiple factors affecting it. So there's no guarantee, but I've had a lot of patients where I will treat them and they weren't crawling, and now we've realigned their hips and we've treated their sacrum, their tailbone, and now they can use their joints in the way that they were meant to be used. And so they start crawling like the next day. And I love hearing those stories. I get so excited every time. Like I have been doing exclusively osteopathic treatments now for maybe about 5 years. And when I hear stuff like that, I still get so excited about it. I'm like, really? It worked? And that's why I do what I do, because it's just so cool to see those changes. And one of my favorites is treating babies that are having latching issues, because when it works, and it works amazingly well, just the difference it makes for the family, not just at breastfeeding time, but how much sleep mom is getting, how much sleep the whole family is getting, and just the change in just the dynamics of the family and the amount of happiness that you get when you get more than 30 minutes of sleep at a time. It's pretty incredible. A lot of people want to know, well, are there side effects to these treatments? And the most common side effects are actually extra sleepiness. So babies will sometimes go home and instead of taking their 1 hour nap, they're taking a 3 hour nap. Another common side effect is a big blowout poopy diaper. And not every baby does those things. And sometimes they do it at the first visit and never again. And sometimes they do it at every visit. In teenagers and adults, if something has been out of alignment for a very long time, sometimes you can have a little bit of like muscle achiness for the next 24 hours afterwards. I don't really see that in kids. I will see like maybe one kid a year who is a little bit fussier for the next day after a treatment, and then they improve. But that's a very uncommon thing especially for infants. It's a very uncommon thing to see that as a side effect. So what does a visit look like? How long am I going to be there? So I think this is where it differs a lot too from some of the chiropractic visits, is that my visits are long. A new appointment, the first time you come in, it's an hour-long visit. And follow-ups are usually half an hour. Now, as things are improving, there's less and less areas fewer and fewer areas that we need to work on, the visits can be shorter. So sometimes we'll have a visit that's only 10 minutes, but we've still planned for that half hour or that hour, because maybe it's a 15-month-old that has like stranger anxiety, and it's going to be difficult for me to get the treatment done in a short period of time, or it's a 2.5-year-old having a temper tantrum. We're going to try to keep the kid as comfortable as we possibly can during the visit. So sometimes it takes a little longer, and to be honest, I do get behind when that happens. Or if there's a mom that is, having a lot of difficulty breastfeeding, that's a very emotional thing, and I am not going to leave a mom who's crying in the room alone. Like, I'm not going to just stand up and walk out and say, oh, your 30 minutes is over. So I do get behind. But most people understand that then if it's the day that they need a little bit of extra time, I'm going to take that time. I take the time that I need with my patients. I'm not going to rush. So when the baby or child is there in the room, we're going to potentially leave them sitting in mom's lap if that's where they're happy. They might be laying on the table. They might be sitting on the table. They might be sitting in mom's lap. They might be sitting in my lap. They might be breastfeeding during the treatment. We're going to try to keep that child in their happy place. So if it's, laying on mom's lap or dad's lap, or mom laying on the table and them laying on mom, or, them sitting on the floor under the table. I've treated kids there too. So I'm very flexible with the position that your child is in. We're going to try to distract them with games and toys. Right now with our COVID pandemic, most of my toys had to be put away because our office manager said, oh, we can't guarantee that they can be perfectly cleaned in between every visit. So always a good idea to bring some of your own toys too. But once the pandemic is over, we have lots of toys and books and things that maybe they haven't seen before that we can distract them with. That's where my medical students and my residents that work with me also come in handy, because I'll make them play games with your kid. They'll be playing peekaboo, or we'll be singing songs, just anything to try to keep them happy and distract them and turn everything into a game as opposed to scary. So with that being said, will my baby or child cry during the visit? Anyone who has a toddler or 2-year-old knows that your child could decide to have a temper tantrum because you wanted them to wear the blue shirt, right? Like, they are very dependent on naps and when they had a snack and what way the wind is blowing. So if it's an older child or toddler, they may scream the whole time just because they're having a temper tantrum. But the treatments that I do are not uncomfortable. There is not any pain involved. Most of the things that we do are extremely relaxing, actually. Adults and older kids actually, especially adults, a lot of times if I'm treating them, will say, oh, like you could just do that for an hour, because it is very relaxing. With the babies and younger kids, they have difficulty understanding why we're doing what we're doing, because it is a different way of being touched. Babies are used to like whole hand touch, like you pick them up with your whole hand, you put your whole hand around them, like under their arms when you pick them up. And a lot of times I'm checking very discrete areas, like, a specific spot on a bone, or the, specific spot where a ligament inserts onto the bone, or, where a muscle inserts. And so, for them, they're kind of like, well, you're just using like half of a finger pad to feel one spot. And it's like, they're like, well, why are you poking me? And you're not mommy. And so some babies will, and toddlers will cry during a treatment. Usually if they cry during the first treatment, with subsequent treatments, they kind of get used to it and go, oh, this doesn't hurt. This is okay. Sometimes crying is actually their body's way of also kind of emotionally releasing some of the trauma of delivery or some of the things that their body is through. Sometimes that act of crying actually helps get rid of restrictions in areas, especially their head. So the crying isn't necessarily a bad thing, but parents are always in this position of power. I tell every parent when they come in for the first visit, if your baby is crying and you're okay with it, then I'm okay with it. If it's just a little like whimper, it's not, that deep, really upset cry. But if it's that really upset, deep cry, then you're in control. If we want to hit pause and take a break, we can take a break. If you want to just stop, then we can just stop. It's entirely up to the parent. They are in control. Because I want everybody to feel comfortable with everything that we're doing at every moment, because kids are such precious little beings, and there is no one more important in your world than your child. And I don't ever want to do anything that makes a parent feel uncomfortable or questions whether or not we're on the same team or have the same motivation. We all want the same thing, and that's to help your child. So if at any point a parent is uncomfortable, tell me to stop and I'll stop. What areas of the body do you treat? Do you do, quote, cranial sacral treatments? So I treat the sacrum or the tailbone. I also treat the cranium, the head. But I wouldn't say that I just do cranial sacral treatments. Within the osteopathic philosophy, yes, there's a very direct connection between the head and between the sacrum. And, there are some very good cranial sacral therapists out there that treat those areas. But because I take a more holistic view, I treat the whole body. So I usually start at the toes and work my way all the way up to the head. I usually try to save head for last because babies get fussy if you go straight for their head, right? So I try to play with their feet, make friends with them first. But while I'm playing with their feet, they may think I'm tickling them, but I'm actually checking all the little bones and all the ligaments and all the muscles through the foot and through the leg. So we're going to check the whole body, because tension in one area of the body can affect the rest of the body. The body is a unit. That's another osteopathic philosophy. How many visits do you need? Do you, quote, need? How many times will you be seen? That varies based on your child and how your child is responding to the treatments. Because they are such in-depth treatments and because we treat the whole body, I don't generally treat babies more often than once a week. I want their body to be able to respond to the treatment, because sometimes we kind of are nudging their body in the right direction and their body takes over and continues to change and heal on its own. And my theory is, if we're bringing them back much sooner than a week, then we're interfering with the body's own inherent capacity to heal itself. And We are also making you drive and or pay a copay and or, you know, taking a baby out of the house is not easy. That's a lot of effort, especially if you have more than one child. And so I'm not going to make a parent come if I don't feel like there is going to be a significant improvement to be had by having them be seen so soon. On average, most babies I end up treating like once a week for 3 weeks, and then I'll space it out a couple weeks, and then I space it out a month. And usually by right around 6 treatments, we're saying like, okay, everything that was out of alignment, everything that was restricted is improved. Now, with that being said, if your baby has been treated previously by someone else who does body work, sometimes that goes quicker. If your baby is younger, like that baby that was only a minute old or, you know, a week old, those babies treat faster. So we might not need to do 6 treatments. Babies that are older, things have been restricted for longer and can sometimes take longer to treat. Or babies who have been through a significant health issue, have been in the NICU, had a very traumatic delivery, were breech for their delivery. Those babies a lot of times will take a little bit longer to treat. But my goal is to not bring you in any more often than you need to get a good result. If I think that it's going to be of a benefit, then I'll say, oh yeah, like let's bring you back in a week or 2 weeks. But if the baby is doing really well, then well, maybe we space it out a little bit more. So it is very dependent on your individual child's response. And sometimes I get surprised. I had a baby who was born by C-section because they were breech and they were very large. And I'm like, oh, this baby's going to take a while. But within 3 treatments, that baby really responded. They really wanted, their body really wanted to improve. And they were fairly young when they came to see me the first time too. So like, I was really excited. I was like, wow, he is doing much better than the average. So, will insurance pay for my treatment? Do I need a referral? Those are other big common questions that I get. Whether or not you need a referral really truly depends on your insurance. We will see patients who self-refer. But if your insurance is one that requires a referral, because it would be billed as a specialist. So if your insurance requires a referral to a specialist, then you will be safer if you get a referral to come to our office. Whether or not your insurance will pay for the whole visit, part of the visit, none of the visit, that really is extremely variable depending on the insurance plan. I've had actually really pretty good luck with state insurance plans, with Anthem, with TRICARE. Sometimes United and Aetna can be a little bit more finicky. Sometimes you need to get a pre-authorization before the visit, before they're willing to pay for it. But if you have any concerns or questions, because I can't keep it all memorized, the easiest thing to do is, you know, call the number on the back of your insurance card and ask them. We are always more than happy if you call the office to provide you with some of the common billing codes that we use. Of course, I can't guarantee that's going to be the exact one that we use when you come. It depends on how many areas of the body we treat, what areas of the body we treat, what the complaint is, what we find when we examine your little one. But most of the time, if you say, oh, I'm bringing my baby in for torticollis, where they can't turn their neck one way, then usually I can say, okay, well, these are the most common codes. This is probably what we're going to use. And you can give those to your insurance company and make sure that they would pay for it. We do, for people who are self-pay, we do have a 10% discount on the day of service. So if you pay that day, you get 10% taken off of your bill. Because we do accept insurances, we are bound by the rules that govern state insurances, and so we can't do more than that 10% discount. Where are we located? We are in Blacksburg. This is our phone number, our website, our address. If you type VCOM Sports and Osteopathic Medicine. That's the name of our office. The website should come up. Our website is undergoing some renovations right now. So some of the information may not be the most up to date. I do share an office with sports medicine docs, with physical medicine rehab docs, with regenerative medicine docs, so and other doctors that do osteopathic manipulation as their primary. So you'll see information about that on the website as well. We are actually pretty easy to get to if you are headed to Blacksburg and you take the 460 bypass. We are not that far from what's called the South Gate exit, right off the bypass. And Google Maps and everybody is, got our address in there correctly, so you should be able to find. And our receptionists are actually amazing at giving directions, because when we moved into the building we're in, there was a lot of construction, and so they got really good at giving people directions based on landmarks of what they saw and where they were at. So if you're lost, if you can't find us, give us a call. But I hope you guys are having a wonderful, wonderful day. And I know there's a lot of other people that are going to give you some really good talks today too, but hopefully this provided you with some information. And have a great rest of your day.